Thank you so much for joining us. It's Thursday, 21 December 2023. My name is Victor Achibong, and this is the issue. Of course, you know this segment of the issue on our radio station focuses on general health. I wanted to discuss on an area that has to do with general health care, where you check yourself physically and also put yourself in the right perspective as you age. But kind enough, we have Ikeja Electric here, and they bailed me out because you might begin to think that I'm a medical doctor. I'm not a medical doctor. I'm only a broadcaster. So kind enough, Dr. Oyekamin Ulugbenga, a principal medical officer at the General Hospital Ikorodu, and is a very senior doctor in the obstetric and gynecology department and maternity of the General Hospital Ikorodu. Good morning, sir.
Good morning.
It's
It's a great pleasure.
yes, I had to take that off because honestly, I was looking like you were writing drugs here, but it's actually. But it's good to have you in the house.
It's a great pleasure to be here.
Yeah,
As
Merry
they say,
Christmas.
Health
Merry
is wealth.
Christmas. Health is wealth.
Health is wealth.
Health
Your
is
greatest asset is
Mm.
your health. So
That's
you need to redefine that and maintain that
That's
at all
fantastic.
times.
Mm. And it's
Right.
true because so many persons who know, I think it's ignorance.
Definitely.
It's ignorance that make them to just, overlook some of these things that
Exactly.
doctors
Exactly.
explain to them. That's why we see people applying or using
Self-medicating.
self-medication for themselves, which is totally wrong. But we're happy that you're here, and today we're going to be talking about operation on pregnant women for delivery of their babies called Caesarean Section. Caesarean Section is what we are discussing today. But first, let me wish you Merry Christmas and
Okay.
Happy New Year in advance.
We should the same.
And how are you preparing for the Christmas?
Well, everyone right now is preparing one way or the other,
Okay.
despite the serious economic challenges of
Mm.
this post-subsidy removal and all that. A lot of people are struggling financially, to maintain their health, and the cost of living is on the rise. The government is trying as much as possible to ease that in
Yeah.
terms of transportation, to ease their burden, their serious burden to maintain life at this, time we are now. And health is one of the greatest challenges we have that needs to be maintained. Without a good health, no other aspect of life can go on smoothly. So,
So, but then, whatever happens to the ordinary man, even in different fields and profession, it also happened to the doctors.
definitely.
How are doctors taking this generally? Because I know a lot of persons come to doctors for advice, for counseling, for medical checkup and all of that. And a lot of times, doctors are so calm responding to patients. It's a different thing when you see other medical attendants in the office or in the hospital. Some of them sometimes can be very funny when they are attending to you. But when it comes to doctors, there's this calmness. So are doctors really feeling the calmness? Or this is just part of the profession to remain calm in the midst of chaos?
Exactly. It's part of the training.
Mm.
The training entails you, working hard and remain calm emotionally, psychologically, physically. You need to be physically fit. As in our profession, we know, okay, what to eat, what to take, what to really to maintain a healthy lifestyle. So doctors are supposed to, not be agitated like others. Like in the general hospital, you say, it's over dependent. There are so many, and there is population explosion of population. Like Ikorodu here now,
Mm.
and in fact, I saw quite a sizable number of patients from Surulere. They point at me, doctor, you were the one that took my delivery. You were there at my delivery when I was in Surulere. What are you doing there? I relocated. So Ikorodu is another, terrain where there is been population explosion. So the population here has increased massively, massively, and I can see that Ikorodu. Though they said Alimosho is number one in terms of population,
Yes.
but I think Ikorodu too. The large number of patients we are having is a reflection of, the mass movement from other local governments. Why did you move here? They will tell you, okay, I mean, cost of living here seems to be low. Getting land here is affordable lifestyles. So in the general hospital now, we have so many patients, so we are always, we're always under a lot of stress. But in the midst of that, you need to remain calm. Unlike other staff, they're agitated. These economic challenges that we say is making a lot of people to misbehave. But in the midst of that, doctors, emotionally, psychologically, and mentally, you need to be fit. You need to be stable to respond, to treat your patient well. That is one of the professional ideals of a doctor that needs to be imbibed at all times.
Thank you very much, Dr. Yekomi Olubenga, for that. And in fact, I must say that is very soothing and relieving for even me right now. I'm feeling like a patient and I'm feeling calm the way you're responding to this. And as regards the comparison you made with Alimosho and the Ikorodu, yeah, I must say that statistics was way back 2006 if my record book is right. So, like you said, if they do a census again right now in Lagos State,
Ikorodu should be the number one.
Oh wow!
To be topmost.
People come into Ikorodu almost every day. Every day. Okay, let's go down to the discussion of the day. We are looking at pregnancy and we are looking at delivery, and specifically we are looking at Caesarean section. What exactly is Caesarean section for the benefit of the layman who may not have heard of this before? What exactly it is?
Okay, yeah. You see, let me start by discussing labor. When a woman is pregnant, after about, the layman will say after 9 months, it is exactly around 10 months, the woman is supposed to go into labor. Labor is a natural process, but it is unpredictable. There is so much inherent unpredictability. It is not predictable. Even the most normal birth can end in complications and can require sudden intervention. Oh, this woman has delivered 3 or 4 times before. Now the fourth baby is coming. We expect that, okay, this labor, it should be smooth, it should be easy, in fact, for the woman to deliver. But things can just go wrong. Every delivery, every labor is different. And women should know that. The way you delivered last time, in fact, the current as you are delivering now is different. It's a different terrain. Things can just change. That requires sudden emergency intervention called Caesarean section. So a Caesarean section is basically the delivery of a baby through a surgical incision in the abdomen. What the layman will say, in the stomach. Because people feel that the stomach is everywhere, just below your chest. It's called the stomach. So it's a surgical incision through the abdomen. And then the womb, which we call the uterus. So when the incision is made, the baby is delivered. So it can be a planned work. It can be planned, what we call elective. Some women, when they get into pregnancy, when they are pregnant, they tell you, you have to label them. There is high risk, low risk, and no risk at all.
Okay.
So we define them. Some, like someone who has had deliveries by operation 2-3 times, automatically you should be prepared for another Caesarean section. That one is planned. She's not going to go into labor. We're not going to make, she should not fall into labor to avert complications. And one of such complications is women like that, they can rupture that previous incision site in the womb.
When you say rupture, how do you mean?
That is tearing. It can tear suddenly during labor. It can tear. I'm going to go into that later.
Okay.
Then it can be an emergency. A woman in labor that cannot deliver. She can't deliver now. What are the situations and all that? Things have changed and all that. Maybe the baby is not feeling fine. Then an emergency operation can be planned. It is usually done where vaginal delivery is not feasible or where the progress of labor constitutes a very big risk to the life of the mother and the baby. So both of them, they are at risk of dying, of damage, of irreparable damage if they don't, die. So those are the situations where Caesarean section is done. It is a safe procedure if done in a standard hospital. it is usually a safe procedure. Unlike our, in fact, where we are now, you say you browse the internet, you read a lot and all that, but like you said, ignorance makes people not to conform to standard. It makes people to have unnecessary phobia, fear. So if done in a standard hospital that has well-equipped machines,
And seasoned
doctors, competent
competent doctors.
skilled attendants, skilled health professionals,
Mm.
like in a comprehensive health center like general hospital. Though many private hospitals, they are well equipped.
Okay.
They may not be well equipped like in a general hospital setting, but they have basic equipment to operate. So if properly done there, it is usually a safe procedure, and it should be performed by clinicians who have competency in the procedure or under direct supervision of an experienced trainer. And that is the situation we have in all the general hospitals, all the comprehensive health centers, LASUT, Island Maternity, and various. So the Caesarean section is basically just an incision on the abdomen and the womb to deliver the baby, and it is usually done as an emergency or planned. Some women, when they are pregnant, they should not go into labor, or else things can go wrong.
You differentiated between abdomen and stomach.
Exactly.
Can you please do it again or say it again so that people will understand? This is stomach, this is abdomen, there's the lower abdomen, there is the upper abdomen, but there's the stomach, there's the womb, there's the uterus. You mentioned all of these things for the benefit of those who really need to know. Like I want to know, so that when we are talking, okay, I could be the one explaining to my daughter, or my wife could be explaining to my daughter, and then I make them understand these things. So the same thing goes to someone who is out there as well. For the purpose of learning, let's differentiate. I want you to differentiate it very well for us.
Okay. Now, generally, if I ask you if you develop an abdominal pain, you will tell me, "Oh, what's wrong with you?" You tell me, what do you tell me?
Like
I have stomach pains.
Like in pidgin, belly the pain.
Belly dey pain me.
Okay.
Most people generally feel that the stomach is just any, in fact, the part of the
Any
body,
kind of discomfort
the
you feel
part
there,
of the
stomach
body
pain.
that is below the chest
Okay.
is generally termed, especially by Nigerians. Many people feel that the stomach is just all the areas below the chest.
All
That is
right.
generally assumed to be what is called the abdomen. But we in the medical parlance,
Okay.
medical language,
Okay.
we call it abdomen. Your abdomen is the region just from the lower end of the chest,
Okay.
down
That would be after the
down
diaphragm.
to the pelvis. Yes, exactly. I
Okay.
don't want to go into details of the diaphragm and all
Please
that.
don't go into the details,
Exactly.
please.
The diaphragm separates. The diaphragm actually separates the stomach.
Oh wow.
The chest separates the chest from the abdomen.
Okay.
So it is a lining
Oh wow.
on the left and right sides.
All right.
It's a lining. So let's just feel that.
Yeah.
Now the abdomen is just below the chest.
Down
Below
to
the
pelvic.
chest. Yeah, down to the pelvic area. That is the abdomen. And in the abdomen, we have many organs there. The kidneys. We have two kidneys, left and right kidneys. We have a liver, which occupies almost 1/3 of the abdomen. The liver is so big.
Wow.
We have the spleen. We have so many other organs. Then we have your stomach is part of the abdomen. Your stomach is one of the structures. It's one of the structures in the abdomen. It is on the upper side, actually. Then from the stomach, we have the intestine. When the food passes from the esophagus, when you drink water or food, it goes down through the esophagus and then into the stomach. From the stomach, it enters what we call the bowels, the intestines.
Wow.
So we have the small intestine and large intestine. And the large intestine, in fact, is so long. In fact, it's almost about 6 feet from here to there. So, and then the bladder is there.
Okay.
The bladder is another organ in the lower abdomen that stores urine from the kidney. After the kidney filters urine from the blood, there's circulation in the kidney. So
Dr. Yekom is just taking us through
abdomen.
biology right now.
Exactly.
Quite interesting. It's good to have this knowledge again. I mean, for a very long time, many of us don't even know. You know? And just as you've said, this is top much. Okay, we're trying to give us some indications.
Exactly.
And explain what the Caesarean section is all about. Now, while you're picking that out again, I'm going to ask, why is it on the rise this period? What is responsible or solely responsible for increase in the cesarean section amongst women. You said some few things, but we've noticed that despite the fact that we know this thing can be cost effective, yet women still go for cesarean section. Why?
Well, right from I would say that Caesarean section globally, not just in African sector, globally the CS rate, Caesarean section rate has increased for women of all ages. Take their ages, under 20s, under 30s, under 40s. Statistics has proven, scientifically proven fact that Caesarean section rate has increased in all ages, all races, all ethnic groups, and all depending whatever the age of the pregnancy, which we call the gestation, it has increased generally. Statistics in Nigeria too has increased globally generally. In UK, let me just give you a statistic: 25% to 30% of all babies are delivered by cesarean section. They are delivered by CS. In the US, about 33% are delivered. That is 1/3, 1 in 3 cases. And over there, technology, there is advancement in technology. In the past, if a woman wants to have cesarean section, it is done when the woman is given what is called general anesthesia. In the past, it can be in form of alcohol to, put the woman into a state of coma, into a state of, sleeping, a deep sleep. I would say deep sleep. That is dangerous. In the past, that's what obtained then. Unlike nowadays, where the CS can then be performed. But nowadays, there is increase in technology. Look at our mobile phone. It wasn't there before. But now you have, you can quickly communicate. Communication has, due to advancement in technology. Also, the CS is usually done under what is called spinal anesthesia or epidural anesthesia. Anesthesia means to put the patient to sleep so that the operation can be performed peacefully, can run seamlessly. So that anesthesia is by injecting certain medication, drugs at the back. The brain, there is a fluid. There is a fluid that flows from the brain down through the bones. The spinal cord is there. From the brain down to the spine, down to the lower back. An injection can be infiltrated. It can be instilled into the back, into the fluid, and then it deadens, the whole abdomen is deadened. And the woman is conscious. That is advancement.
Would she be conscious when that injection is applied on her?
Yes, she'll be conscious.
So the moment that injection is applied, she'll still be conscious.
She will still be conscious.
The CS will be carried out.
The CS will be carried out peacefully, seamlessly, without that portends that the woman is going to.
How did science discover this? It's a question, but it's going to be something to discuss some other time. When we are going for discovery and all of that.
Let's just take it that there has been massive explosion in technology advancement. So there's technology advancement. So like in abroad, like you said, many women, since they have this access, even when they're in labor, they don't want to feel pain. Or in both people, they like to go into unbearable pain, like we here. We screaming in labor and all that. We are rugged. In fact, we are rugged. So over there, they are giving what is called epidural anesthesia, in which it will knock off the pain. And the labor goes on seamlessly, and the woman delivers.
And after delivery, is there a possibility of the pain coming back, and excruciating pain coming back?
Of course, all drugs, what goes up must come down. The drugs have to wear off.
Oh, wow.
When it wears off, definitely the pain comes down. But there are medications, oral or injections,
that will help to subside the pain.
Exactly. That will help to alleviate the pain to a barest minimum.
Okay.
So, as you said, going back to the question, CS rate has greatly increased. Globally, all over. Due to, in the past, you would say that our mothers in those days, at 45, 50 years, they were even having their children and all that. But you see, we still need to. A lot of research is going on. Why there has been what we call global, climate change. The oxygen level we are breathing now, there is depletion of ozone layer. The oxygen we are breathing now is not the same like in the past. There is industrialization. So many industries have sprung up and emitting carbon dioxide. Carbon dioxide has reduced the oxygen level in the atmosphere. So ozone layer depletion is one of the climate changes and all that. In fact, heat everywhere, pollutions, all this has reduced the kind of oxygen we go in. So all those things also affect our natural body. Even in the past, you know that people are living up to 90 years, 100 years, and all that longevity. But these days, standard in fact, life expectancy in Nigeria, all the life expectancy 46 years, 46 or 50 years. A lot of people just die from so many cardiovascular diseases and all that. Life expectancy has reduced. So we can attribute all that to climate changes.
Even the hustle and bustle of Lagos State,
Lagos State, the
especially those
stress
living
of
in Lagos
lifestyle,
State.
the stress of lifestyle is so is so great that it can reduce one's life expectancy, and that has brought about increase in cardiovascular diseases, heart diseases, hypertension, stroke, diabetes. They're on the rise. All these comorbidities, all these medical health conditions has reduced life expectancy so much. So globally, CS rate has increased. Generally, all women about 20%, 1 in 5. In fact, in general hospital here, I can say 1 in 10 goes for CS. 1 in 10 deliveries goes for Caesarean section, and there are many indications for that, which I could quickly go into that.
Please, go on.
So the indication, why should a woman? This woman has had several deliveries. Why should she go into Caesarean section? This woman is first timer deliveries. Their labor is special. They are going to labor for the first time, so they need to be seen at a standard health facility or where they have a competent doctors. But many people, many pregnant women, they just register at unauthorized places to deliver. So let me go to the causes. There are so many causes. It can be the mother condition, the condition of the mother, the condition of the baby, the condition of the placenta. See, the developing baby in the womb is attached to the mother by what is called, there is a rope that attaches from the cord, the umbilical cord, to the placenta. It's a flat, just like meat. It's a flat meat inside the womb, and they are inside the nylon bag. That nylon bag is called the amniotic membrane. It's a membrane, and then the water, the amniotic fluid, the water shields the baby. It cushions the baby from. It's like a buffer. It's like a shock absorber. Even if the woman, so many women from Okada, from road accident, they say, nothing happened to her. What happened? Ghastly accident. Nothing happened to her. The baby is still intact due to the water surrounding the baby. So it acts as a shock
even
absorber.
If there's any kind of impact,
even
because of the water that the baby is inside,
yeah,
the baby won't feel the impact.
Won't feel it. So the placenta is also there that nourishes the baby. So the placenta situation too can be a condition where some women go into Caesarean section. Now let me try from the baby aspect, baby mother disproportion. The mother has what is called the pelvis, the pelvic bone. The pelvic bone is like a cylinder. It has the opening, upper opening and the lower opening. Upper opening and the lower opening. There is a certain measurement that the pelvis is supposed to attain. Women have a pelvis called gynecoid. It's a medical term. Don't worry about that. Gynecoid pelvis. Their bones, like this. Their bones are wide. The width of the space inside is wider than for a man. And then the upper space and the lower space. So, but surprisingly, some women have what is called inadequate pelvis, contracted. The pelvis is called contracted. It's like locked up. So there's no way that baby, in fact, baby of an average size, 3 kilograms. Usually most babies are born 3 kilograms. 3 kilograms, 3.1, 3.2, 3.5. Usually around 3 kilograms. A baby of 3 kilograms will not be able to pass through that. So we call that condition when they're in labor CPD, cephalopelvic disproportion. They have what's called CPD. The head cannot pass through because the pelvis is inadequate.
Okay.
So that pelvic shape is one condition. Inadequate pelvis. Inadequate space in the pelvis. Why some women go into they are the doctor has to opt for a Caesarean section. Then number 2, we have what is called big baby. In medical term, we call it macrosomic baby. Macrosomia. Baby bigness.
Just like from the word macro.
Exactly. Average, like I said, most deliveries between 3.0 to 3.5, sometimes 3.6. Few women have delivered 4 kilograms, 4.1. In fact, which that is not common. So it's rare. So a baby weighing 4 kilograms is a big baby. That labor has to be specially supervised by skilled birth attendants, like competent hand, or else, because most likely that head will not fit into the space of the pelvic bone. So that is one condition where big baby. Some women, women eat a lot. It can be due to food. Some of them have this craving for Coke, Fanta, soft drink, Coke, Fanta, soft drink. They eat so much and the baby will be getting bigger and bigger and bigger. Then there is a time. There is a time to be born, a time to die also. Like a time for everything under the sun. A pregnancy that's been, a pregnancy in the womb, the baby development there has a time to come out. Doctors will calculate what is called expected date of delivery.
That's the EDD.
EDD, yeah, thank you. EDD, expected date of delivery. So that baby is supposed to come around that time. We can still give that is 10 months. It is actually 10 weeks. You have 10 weeks. 9 months, which is our own 9 months, is not the general people who are saying 9 months, 9 months, 9 months. Every 7 days is a week. So we add 40 weeks. 40 weeks is when a woman is supposed to put to bed.
Generally,
some
okay,
women.
Let me say.
Let me just explain.
Okay, please do.
Some women, they don't go into labor at 40 weeks. They will still extend till 41 weeks, 42 weeks, and the baby is getting bigger and bigger and bigger there. So by the time they are really in labor, the baby is too big to come out. So that is one condition. When the baby is so big, then in twin pregnancy, twin gestation, twin pregnancy, twins, you have 2, carrying 2 or carrying 3, triplets, sometimes quadruplets. How will these babies come out? Definitely there's going to be, if the leading twin is coming with a breech position, that is the buttock, it is the buttock that is coming down, that is at the pelvis to come out first. Pelvis to come out first, that is breech. Then definitely that twin is going to cause obstruction in labor. The second twin will not be able to be delivered. Even the first twin can have difficulty to be delivered. The babies can die, they can be fractured, there so many things can go wrong. So that is one condition in twin pregnancy. That's the third condition where doctors opt for Caesarean section. Yeah. Then there's a condition we called abnormal presentation. When the baby is lying transversely across. If the baby is lying across, normally, naturally, a growing pregnancy, the baby is supposed to assume head down. Or the worst abnormal is breech position, where the buttock is at the pelvis. Baby is in a sitting position.
And it's the buttock that is at the pelvis. Where the head is supposed to pass through.
The buttock is there. So that is one condition, breech presentation. That one I said across is transverse presentation. Okay. Then the head itself, even if the head is down, some babies, the head is supposed to be flexed. To be really flexed, to touch the chin during delivery.
Okay.
But some babies, they will put their head up. That is abnormal position, what we call face presentation.
So it is not be the face that will be facing the pelvis.
Instead of the skull,
from the ground, the skull here,
exactly, the head coming down. The face or the forehead is called the brow.
Okay.
Or the forehead. So that will cause an obstruction during labor. So malpresentation, called abnormal presentation of the baby, is another condition where we do Caesarean section. And sometimes the cord too can come out. the cord can present. Usually the cord is a way, it's the head that goes down. But surprisingly, somehow during labor, that's why I said labor is unpredictable. Things can just go wrong. The cord can come out, and that cord has blood vessels that supplies the baby, nourishes the baby with oxygen and nutrients from the mother. So when that cord comes out, the head or whatever is presenting will impact on it. There won't be blood flow to the baby, so the baby can die. Then there's a condition which we call fetal baby distress. During labor, some babies, if the labor is getting so long, maybe 12 hours, 14 hours of labor, the baby goes into what is called fetal distress. Baby distress. Baby becomes uncomfortable. In a comprehensive center, it can be detected by the heartbeat of the baby. Normal heartbeat of the baby is between 120 to 160. But when you are recording 160, 170, 180, 190, the baby is telling you something that, oh, I'm not feeling fine. I need to get out.
It's like when one is becoming
Exactly,
hypertensive.
choked up. Exactly. You need to get out of this place soon, as fast as possible. If care is not taken, the baby can just die. So that's what we call fetal distress. Exactly, stillborn.
Okay.
Then there are placenta factors.
Okay.
When the placenta normally is supposed to be in the upper part of the womb, called the fundus, or the front part, or the back part. But sometimes the placenta will assume the pelvis. It is in the lower side of the womb. It is occupying the space where the head of the baby or the bottom of the baby is supposed to pass. So there is no way that baby can be delivered. And that causes usually bleeding. So many women, they come with bleeding due to low-lying, what you call low-lying placenta.
Just go there to cause traffic jam.
Exactly, traffic jam.
Block everywhere.
Block everywhere. So that's called placenta factor, low-lying placenta. Then there is a condition we call abruptio placenta. At detachment, the placenta attaches firmly to the uterus, to the womb, and the blood from the mother goes through the placenta to the cord. But sometimes the placenta detaches. The placenta detaches, either due to trauma, like during accident or all that. From women, during accident, the placenta will detach, or trauma during a fight. One can blow up a woman during a fight, during a brawl, and then the placenta detaches. That's another condition where
Dr. Olubenga, I'm going to pause you there a little.
Right.
I'm going to pause you there a little because I think there are so many conditions here.
So many,
and interestingly, you've given us major conditions. I'll ask a question after I make these statements. A man who hears all these that a woman goes through and yet lays his finger on that woman, I wonder.
Fingers out?
As in beating the wife. With all these that you've said, this happened to women a lot of times. I know I'm deviating from the topic.
Exactly.
I'm not going into family. But this is, I wish men who batter their wives, who beat their wives, whether emotionally or physically, can take the place of woman and be in the hospital and see what the woman is going through.
So we even encourage the women, the men, to see what they are passing through.
They need to encourage
Sometimes
the women.
they pass through. The women, when they deliver normal delivery, some of them develop what is called serious laceration, tear of the vagina.
That's true.
We call it 2nd degree, 3rd degree. There's even a 4th degree that has turned into the rectum, anus. The tear has extended to the anus, and that needs a specialist
to
repair that.
She can't wee.
And such women,
if she does, she'll be in pain.
Such women, they will go into the next pregnancy. They're going to go for. We're going to tell them to opt for Caesarean section. That's one of the indications, the reason why women go for Caesarean section. 3rd degree, 4th degree, serious vaginal lacerations. Then there's what called cancer is everywhere. There's some women have cancer of the womb. Cancer of the cervix. The cervix is an area that the baby comes out from. The cervix, I'm sure you heard about cervical cancer. It's one of the leading cancers in women. So cancer of the cervix in women who are pregnant, they go for Caesarean section.
We're already getting calls, and I think at this juncture we'll entertain some calls because this is much to take. It's on 0904081161 and also 0904082161. Ask our doctor anything you want to ask. Hello, good morning. Yes, please. How you doing? Okay, Lastapa. Thank you very much. Go ahead with your talk. All right, thank you very much. I hope you got the question that he asked.
Yeah.
Okay. All right. So two women, one gave birth through normal birth, and the third one CS.
Yes.
The other one gave birth through CS, and the last two normal birth, normal labor.
Yeah.
That's a very unique situation.
Exactly. The way a woman delivered last time can be different from when she's delivering at the moment. It's a different terrain, it's a different situation altogether.
Okay, all right, thank you. Now, let me ask this question that I want to ask. You made mention of the pelvic size, the hole. Now, can that expand over time during pregnancy, or as you grow and get to that point where you can bring your eggs, can fertilize with that of the man, there is no growth, no expansion on that pelvis anymore? Is there a form of exercise a woman can do to help expand the pelvis, or this is how it should be according to nature?
Well, it's just like when we're growing, you grow to your highest height by 18 years, sometimes 19, 20 years.
Yes.
You can still grow to some extent.
In some cases, 23, 25.
23, exactly. You can still grow a little bit, but usually the pelvis is fixed. Once an adult goes into labor, the pelvis do not. There is no amount of exercise or any maneuvering that can be done to expand the pelvis, the space inside the pelvic bone. So it is a fixed measurement for all women.
Thank you, doctor. I need women to call. I need women, especially if you are, expecting mother, you need to call. This is your radio doctor here, Dr. Lubenga, and is giving you lots of insights, lots of thoughts, ideas, okay, that will help you, a waiting mother, a pregnant mother, okay, or a pregnant woman, to deliver safely. And we are talking about Caesarean section. The number is 0904-081-1061 and 0904-082-1061. Doctor, let's ask this person what the question is. Hello, good morning.
Good morning.
Yes, please. Who is on the line? Mrs. Oriyomi, welcome. The doctor is in the house. Please ask the question.
Yes, I want to ask doctor some questions because on the tune of this year, I come to operation. So some of my doctor is telling me that before I can get pregnant again, it should be maybe after 2 years or more than that. But that case is still very for now. So there is like 7 months. I think maybe January is going to be 7 months. So that's the question I want to ask.
So, in other words, you cannot wait till 2 years. You want to born sharp. Okay, congratulations.
Now my first child go back. So that is why I'm thinking maybe can I get pregnant after 8 months or 9 months? But people are saying I should wait for 2 years.
2 years.
3 years I was like,
okay.
So that is what I'm around.
Thank you for coming out. Listen to the doctor. He's going to speak up now. All right, doctor, over to you, please.
Okay, that was a very good, great question.
Yes.
How long after a Caesarean section can you get pregnant? How long? So there are 2 schools of thought concerning that. You see, the Caesarean section, apart from the skin of the abdomen, then the womb also has been breached, has been torn. The womb, it takes at least up to a year for the womb, for the uterus to heal perfectly well. A school of thought said at least 12 to 15 months should be the right spacing.
That's 1 year, 3 months.
Exactly, 1 year, 3 months should be the right spacing. But others say that at least should be 18 months to 24 months, 1.5 years to 2 years. Because women have different, consistency, thickness of their womb. Some, they go into labor and they rupture. So that's why most people who have a previous Caesarean section, they opt for, due to they are not progressing in labor. In fact, a sizable number still end up as Caesarean section.
But
many of them, that's what they call short inter-pregnancy interval. Someone who delivered like say maybe last year, 6 months ago, getting pregnant now, that is within 6 months. That 6 months is not enough for the womb to heal well. The healing process is still taking place, and the womb is not just there. It's not just static. The womb is expanding, expanding, expanding. As the baby is growing, the womb is expanding, it's growing also. So that makes the scar on the womb to also stretch. It stretch to some extent. Despite if it is very still, it is stretched to some extent. So it is not ideal for women within 1 year. So we've seen quite a sizable number, 8 months, 9 months, in fact, 6 months that took in, and then we just have to do another Caesarean section for them when they are delivering.
Okay, so
without
from a
any
professional
complication.
standpoint,
Professional
now,
standpoint,
what advice
at
would you
least
give
12
her?
months to 15 months. 12 to 15 months.
That's 1 year
ideal,
and 3 months.
At least a year should
Mrs.
be the right spacing.
Orisomi, I hope I got that name right. 12, wait for 1 year, 3 months. Wait for 1 year, 3 months, so that you can get complete
Healing of the womb.
complete healing. Okay, it's very important. Doctor, while we wait for another call, there's a question here that I have. Is there any complication with CS?
Of course. Well, there is no procedure that that is not without complication, no matter how simple. So complication can still arise. So many complications are even with the best of, even in the United States, globally,
advanced
in
world.
advanced world. There's this, let me cite an example. There's this suction of the fat from the body called liposuction. Liposuction. I have known someone who went in for that, even abroad, overseas, in one of the best health facility. Just simple liposuction. 100 women, 1,000 women have done it without complication. She went in there, did the liposuction, complication occurred, and she died. So there is no procedure that is not without complications.
As a matter of fact,
Caesarean
doctor,
section
on the
can have
record,
complications.
I have one here. Yeah, it's
Scar.
lipoma.
Lipoma.
And I've heard of the liposuction. Sincerely speaking, when I heard of the various complications, I just told myself we will manage and
well, because it's not at a visible site of your skin. It can be covered.
No, that's what I'm not wearing.
That's
my
you're not exposing it.
I'm not exposing it. No, you will not know. But if my filler is not on, you will see it there. It's very.
Well, there are two different operations altogether. This one just needs a simple operation by a seasoned surgeon to remove that localized fat.
It is fat. It's fat. Yes.
So it can be removed.
Okay.
Or if it's not giving you pains and all that.
No, there's no pain there. There's no pain.
You can still leave it.
Yeah, I'm
so
left it there.
the complications we say, there can be what is called, even after the Caesarean section, there can be sometimes the womb goes into what we call relaxation. The womb just relaxes. What we call atony. Atony. Normally during labor and all that, and the womb is supposed to thicken, contract. When the womb contracts, bleeding reduces. Or sometimes after Caesarean section, bleeding can be excessive. And if care is not taken, if the woman is not well attended to by blood transfusion or to maneuver it or to give some drugs, to stop, to make the womb to contract, the woman can go into bleeding. After delivery bleeding, excessive bleeding, it can be serious. Quite a sizable number have been brought from other health facilities. After delivery, they are rushed by, they are bleeding. In fact, you need to take them in and then put some injection. There are some injections, oxytocin and some others. There is a tablet you can put inside the woman to make the womb to thicken very well and stop the bleeding. Those basic things. When we use them, the bleeding stops. So atony is one complication that. So after Caesarean section, of course, after care is there. The nurses in charge, even the doctors, you have to check that the woman is in the right, monitored. They are monitored closely to ensure that there is no abnormal bleeding. Abnormal bleeding can just occur. That is one. Secondly, the wound. Some women can just have what is called wound infection. You see, any incision on the body. The incision on the body is closed by these threads. These threads are artificial. Sometimes the body reacts to it and it breaks down. So women have wound breakdown. So wound infection can occur. Then another thing can occur is what we call a kind of the intestine not optimal, not performing well. not contracting well, not moving well. What we call obstruction, intestinal obstruction, because the intestine too sometimes they are around the bowels. The intestine during cesarean section they can be pushed back. During all the abdomen is open and the intestine is exposed. They go into what is called paralytic ileus, a kind of relaxation. They are not functioning again. But with some maneuver, they will function better again. Then there can be injury to the bladder. The bladder is in front of the uterus, in front of the womb. So one has to be careful during a cesarean section so that the bladder is not injured. The bowels too can be injured,
Okay.
especially those with previous. Then
Now,
the womb can rupture.
let's also let
Womb
our
can rupture
listeners know
also.
that
That's
you
another
can be a
complication
part.
in
Call
previous
to ask
pregnancy.
question if you're a woman and you are interested in what Dr. Yekomi Lubenga has been saying and you want to answer some questions, please feel free to call. We have just some few more minutes before we leave the studio, and of course, you know, he has to go back to the General Hospital Ikorodu to continue with his profession and his practice. We're going to switch over to another question quickly because of time. Doctor, which facility should a CS be done, and then why is it mostly encouraged that women who are above 40 should undergo a CS? So we are using one stone to kill two birds. Just tell us quickly the kind of facilities that CS should be done, and then for women that are above 40, why always encouraged that they should born or give birth through CS?
That's for first timers.
For first timers, exactly. For
First
first timers.
Okay. Like I said, cesarean section is usually a safe procedure if done in a standard hospital that is well equipped. You have even the anesthetists, you have the skilled personnel to perform the operation.
Okay.
It should only be performed by clinicians only who have competency in the procedure or under direct supervision of an experienced trainer. So in a standard facility, it should be done with basic equipment for operation. So it is usually a safe procedure. So CS is done in a standard health facility, both private, general, teaching hospitals, medical centers. In fact, that's where CS should be done, in which the basic equipment are there, the right personnel are there, skilled personnel are there, skilled attendants are there, skilled workers are there, professionals are there. So,
okay, doctor, let me read this message here.
Then that question that women over 40 years,
over 40 years,
timer. Scientifically, research has been done that you are 35 years, you are going to your first pregnancy, first labor. Their labor is usually slow, it doesn't progress well. So it is not an absolute indication actually to do emergency. But if the labor is not progressing well, they are likely to have a failed progress of labor. So they are encouraged to have, especially those who have had, okay, you are 35 years now, you've been married since 25 years, 10 years of infertility, and you are getting pregnant at 35 or 36, 37. The doctor will be comfortable to do an elective, a planned cesarean section, because it is known to be safer than normal going through vaginal delivery, because complications can occur. But with this cesarean section is a better option.
Okay, so let's read this text message coming from Oluwatayo from a Greek. She said, "Good morning, doctor. My name is Oluwatayo from a Greek. I want to ask, I gave birth this year, May 5. Sometimes I feel a sharp pain on the scars. Is it normal? Thank you."
Well, like I said, we have different, your body is different from my body. If you have the same operation, my wound can heal much faster. Within 2 weeks, my wound can heal perfectly well. But yours, it can take time, it can break down. It can take months. 3 months, you are still dressing your wound. So I'll advise her to go to a standard health facility to have it checked by a doctor.
Oyekomi Olubenga, thank you very much for coming.
Oh, you're welcome. It's a great pleasure to be
I'm tempted to ask this question before we leave the studio. It is not related to cesarean section, but it is about ectopic pregnancy. So I would need you to talk about ectopic pregnancy for like 2 minutes before we go.
Well,
or less than.
Okay. So that ectopic pregnancy is another reason why a woman, once you are confirmed pregnant, go to your hospital, do a scan as early as possible. Quite a sizable number of women, they have what is called an emergency operation due to ectopic pregnancy. Because that ectopic pregnancy is one of the causes of what is called maternal mortality, women dying as a result of pregnancy. They can die due to internal bleeding. So let me start. Ectopic pregnancy is actually pregnancy outside the womb. The womb is like a ball, like a pear shape. Then on top of the womb, there are two tubes, the right tubes and the left tube. The right and left tubes, they are attached like a finger to what is called the ovary. The ovary. The ovary is where the eggs are made. The baby is a composition of the sperm from the mother, from the man, the sperm from the man, and then the egg produced from the woman. So the baby is not just the man's sperm alone.
True.
So the egg and the sperm. The ovary. The ovary is like a ball, like a table tennis. They're not even up to a table tennis ball. Just like the size of the egg yolk. If you boiled an egg, the yellow inside the egg, that is the usual size of the ovary.
Wow.
So inside it there are tiny eggs. So those eggs, one of them during ovulation, one of them will grow to a maximum diameter, maximum size, and then come out of the ovary into the end of the fallopian tube, the first part of the fallopian tube.
Okay.
The sperm through the vagina, through the womb. When the sperm is deposited in the womb, they swim, thousands, millions of sperm. They swim through the womb, through the tube, to go and meet the egg at the first part of the tube, around the ovaries. Then they now move. The two of them now move. They are now two. Two becomes one. They now move from the fallopian tube, because inside the fallopian tube is a narrow space. Inside the fallopian is a narrow space. They now move through the tube into the womb and embed. They attach to the womb where development takes place gradually and all that. But if for one reason or the other, the fertilized egg, the egg that has been fertilized by the sperm,
merged with the sperm,
and then they remain inside the womb, inside the
fallopian tube,
that is an ectopic. That is going to form an ectopic.
And inside, didn't go forward, they didn't go backward.
Exactly. So they are stuck in there, and in there will be development. The baby continues
instead of it developing in the womb, it will be growing inside the
fallopian tube. Growing. So when it's growing, it will burst. The fallopian tube does not have that genetic capacity.
So that rupture is the bleeding that the woman experiences.
So a lot of women are brought as an emergency.
And most women will think that is just normal bleeding.
Exactly, normal bleeding.
Discharge.
So many of them, even walking outside, if man woke up, she went to work, she just slumped, rushed into the hospital. Anywhere they can just slump and brought, or feeling so dizzy, so weak. You are pregnant, you're feeling so dizzy, it can be due to an ectopic pregnancy. So they need to act fast. So that ectopic pregnancy is one of the leading cause of death of women, especially if they end up in a wrong facility. And one of the main causes is called infection around the tube, called salpingitis infection, what we generally call PID, pelvic inflammatory disease. A lot of women are prone to infection of the womb, abnormal vaginal discharge, yellow discharge, brownish discharge that spread from the womb into the tube. So if it is not well treated, that infection, it creates an unusual environment, a septic environment, an infection environment. So any sperm and egg inside there cannot travel well because that place has been spoiled, has been contaminated. So that is one of the leading cause of ectopic pregnancy, infection in the womb.
Dr. Yekami, I wish we can drag you back so that we can speak extensively about this particular topic. But our time is fast spent. In fact, it's 2 minutes past 12 right now. We're supposed to stop before 12, but it has been a very intelligent, educative, informative program. Thank you so much for making our time.
It's a great pleasure. In fact, it's a laudable program you people are doing at least for us to enlighten and inform and the public about their health. Because health is wealth.
Yes.
At every point in time, Like over there abroad, people go for, even when you are not sick, you are supposed to go for a health checkup. You are sick or you are not, a general checkup, but a lot of people just sit down and assume that, I mean, all is well.
Doctor, we gotta go. But
All
thank
right.
you so much.
Okay.
And once again, Merry Christmas and a Happy New Year in advance
Wishing
to
you,
you.
I mean, the best of the season also.
All right.
I wish you the same.
Okay, so people, that's the size of the program. We appreciate you for your listening, and also we appreciate you for your contribution. It's been a wonderful one. Honestly, we continue this next week. Hopefully, we should be able to get another medical practitioner from Ikorodu General Hospital to come and talk to us about this. This particular aspect, in fact, has been one enlightening, educative program. My name is Victor Achibong. DJ Konami is right here to give you more songs. We'll be back 4 p.m. with more programs. Don't go nowhere. This is IKD 106.1 FM. Thank you, and bye for now.